The World Health Organization, WHO, is meeting in Switzerland to advance a legally binding international accord on pandemic prevention, preparedness, and response. Now, we've been highlighting this on the program here. The Biden administration has reportedly been working with the WHO on this deal, which would hand over public health policy to an unaccountable and unelected international bureaucracy, which, by the way, was helping cover the tracks for China and the Wuhan lab after the leak of the virus. Now, given WHO's inept response to COVID-19, it's hard to imagine that anyone that has half a brain would think about giving them more authority to direct global public health. This is crazy. Joining me now to talk about this is Jim Roguski. He is a member of the Law and Activism Committee at the World Council for Health, who has been tracking this very closely. Jim, welcome back to Washington Watch.
Well, thank you very much for having me. There is so much misinformation out there. Where would you like to start?
Well, those that are not aware, give us a quick overview of this agreement or this accord that's been drafted for consideration.
Well, the first thing is what most everyone is talking about is actually, in my opinion, a decoy. There are two separate negotiations going on. Most people in the media are talking about what is commonly known as the pandemic treaty, and that's not what I've been concerned about for the last year. There's a totally different set of negotiations going on, which are proposed amendments to the existing international health regulations. That, in my mind, is of much bigger concern. And almost everybody out there is getting them all crossed up and mixed up. I see the treaty as a real thing. It is a problem. It's a 32-page document. They currently refer to it as the zero draft. The first 12 pages of that document are the sugariest, sweetest propaganda you've ever laid eyes on. The remainder of it has some horrible aspects to it. But that's not really where the action is in my book. The proposed amendments to the international health regulations, totally different document, totally different set of proposals, totally different group that is negotiating them. It's always a clue when the media is all talking about one thing and they're not talking about something else. You got to look at the something else that they're not talking about. And so the international health regulations have been around for longer than I've been alive. It's an existing agreement. And as part of that agreement, all that needs to be done is amendments at the World Health Assembly in May, any May, this year, next year, whenever. Last year, they actually adopted amendments. They simply discuss a document. They say to the 194 delegates, are there any objections? And if nobody raises an objection, boom, it's international law. Nobody is talking about that.
So let's talk about that. What are contained in those amendments?
There are 307 proposed amendments. The current international health regulations only have 66 articles. They would seek to amend 33 of those and add an additional 6 new articles. At the end of that, there are 9 annexes. They seek to amend 6 of them and add a new 10th annex. The summary of it is that they would change the definition of the word recommendation. Currently, the word recommendation is non-binding advice. But Bangladesh submitted a proposal to cross out the phrase non-binding, and Malaysia submitted a proposed amendment to Article 42, which would make it so that recommendations shall be implemented as soon as possible. Even the International Health Regulations Review Committee, which was charged in October, November, December, and January in reviewing these documents, said that that would change the entire nature of the WHO. It would change the entire nature of the international health regulations. It would change it from an advisory body to essentially a dictatorial, totalitarian, command organization. And there's 307 307 proposed amendments. And in the summary of that, the word shall is in there 263 times.
So,
And in
so Jim,
legal,
are
words,
they
shall means you must. Yeah.
are they working on that on a parallel track this week as well in Geneva?
Technically, they worked on it last week. They were supposed to have week-long meetings, a morning session and an afternoon session. They only recorded 4 of the 10 sessions over the 5 days. 6 of the sessions were completely in secret. This week, they're talking about the proposed treaty, and the same thing seems to be going on. They had a couple of recorded sessions, but they had a live session this morning, but now they're
hiding
secret.
it. They're hiding it.
They're hiding it sort of in plain sight. I mean, we do have certain information. Now,
Yeah.
there was a lot of rumors on the internet that said it was a done deal, that Biden had signed it.
Right.
Here's
Hey,
what has been.
Jim, we're unfortunately we're up against the end of the program. We're not taking a break. We got to quit. But I want to get you back on maybe on Thursday as we get more out of Geneva and we can unpack this even more.
All the information is on stopthewho.com.